All right. I think we are good to go. Okay. I'm going to do a brief overview of the DI response for all those in Activity Day Session 2. Um, as I mentioned, I would in class. So let's jump into that. Very briefly, I've got my cat with me. You may hear her in the background. All right, let's do this. Let me find what I want to do. Application. Boom. Here is the DI response over here. All right. I'm not going to go through some of the most obvious portions of this. I think all of this at the top, the systematic approach stuff, is all easy to understand. I will say that had this been more of a therapeutic kind of request, and in most requests, I may simply just go to guidelines just to see if they have anything to say. And I think that's a pretty good habit to get in, especially as you guys get into your IP or integrated pharmacotherapy courses. You'll be wanting to look into guidelines more and more often. So guidelines would be a good thing in here just in general. I've done some searches. I will tell you that the second search, probably an even better way to do it would to be to put a left parentheses on the left side of topical and a right parentheses, another right parentheses over here where it says diclofenac, just to clarify things for you, just to clarify things for you guys a little bit more. But I'll say that it comes with the exact same amount of articles when you put them in PubMed. So there's that. I've researched those things. I've encompassed both NSAIDs in general in rivaroxaban. I've also encompassed diclofenac gel and bleeds just in general. Just a very broad search um, in that regard. All right, so let's jump down to the request. So I've restated the request. Good job. I get points. And the answer, I constructed a very concise and kind of direct answer to the question. I would say that even this last statement where I mention some other um, information regarding like whether or not it's actually necessary to have this combination would be something that you need to kind of consider in some ways. Um, that doesn't necessarily need to be there for most responses, but it was something I felt would be appropriate for the answer section. So I've answered it concisely. I've directly targeted the issue with diclofenac gel, and I've directly targeted the issue regarding NSAIDs in rivaroxaban itself. Um, we are obviously concerned about bleeds, and we're concerned about the overlapping risk of bleeds that inherently come with NSAIDs and the risk of bleeds, and the inherent risk of bleeds with anticoagulant like rivaroxaban. So all that's in there. Then I have the background section. And what I like about the background section here is that the background section goes into specific information about why I would use NSAIDs, and that's for pain and reducing inflammation, but that they also increase the risk of bleeding. And I talk about rivaroxaban in the background section and why we would use the rivaroxaban. And going to say that it also will increase the risk of bleeds. And by taking these simultaneously, um, both rivaroxaban and NSAIDs, we will also increase the risk of bleeding even further. So that's an issue in and of itself. Now, for your question, you've got a therapeutic question, probably. I'm sure that you figured that out by now. Um, so you will want to address that appropriately. So with a lot of therapeutic questions, again, you want to mention why we're using the drugs, why the drugs are appropriate, um, and some brief information about the condition that we're treating, um, especially if we are setting it up in regard to like what are goals and how do we kind of measure the utility of the drugs that we're talking about. So Indrocana and Jardiance, specifically for y'all's question. All right, got my cat on me. In case you're wondering what I'm doing down here, here's my cat. She likes to be on camera. She's great, great. All right, get off me. Back to the topic at hand. Okay, that's the background section and why I like it. In the review of literature section, or the evidence section, as it was called last time, you can use either term. I'm fine with whatever. But review of literature is probably a little bit more appropriate. All right, so I addressed the fact that it is well understood that we have an increased risk of bleeding. But I also say that it's not a specific contraindication, and that we also have an increased risk of bleeding with diclofenac gel. So all that's kind of laid out up front. Like even diclofenac gel, which we're concerned about, indicates that you may have an increased risk of bleeding in and of itself. Okay, so all that's kind of stated up front, and I've kind of more directly targeted the question with some very appropriate references. Again, for an interaction question, reference 1 and 2 is the package insert. I think those are appropriate references to cite early on. So the authoritative references like guidelines for a therapeutic question are great up front, but then we want some of the evidence to support that. And the evidence comes in the form of primary literature. And I've got a paragraph down here that really focuses on NSAIDs themselves and their use with rivaroxaban. And I indicate that when NSAIDs are used with rivaroxaban, so NSAIDs and rivaroxaban, compared to rivaroxaban alone, we do have an increased risk of bleeding. And that's what this statement down here says. I have a hazard ratio and I have a p-value. The hazard ratio is essentially, from what you guys need to know, I guess, would be that if we kind of compare the 15.8 and the 37.6, it's about twice the risk. And we also have a p-value, which indicates that this difference in using rivaroxaban with NSAIDs and using rivaroxaban sort of by itself, and in patients not taking NSAIDs, that is a statistically significant difference. That we can say that there is likely an actual difference between taking it with NSAIDs or not taking it with NSAIDs. The risk of bleeding will be higher with the combination. Before we move on to this diclofenac gel section, or the Voltaren gel section, I want to point out where I should get punched. So I should get punched by citing references 3 and 4 first. This was an oversight on my part, likely because I was creating so many documents at the same time. Probably a lesson I should have learned long ago by taking on too much all at the same time. But lo and behold, I made a mistake. So I referenced resources 3 and 4 first. 3 and 4 are the references that I'm trying to reference here, which are references regarding pharmacology and the idea that there is an increased risk of bleeding with NSAIDs, which is appropriate to say, but the order that should have been 1 and 2 here. Reference 1 always comes first. Okay, so before you turn in your work for a grade, make sure you're checking that over. So that's, for me, that's 3 points off. Boom. So I'm at a 97 right now. I'm happy with a 97. I'll take 97 every day of the week. That's great. All right. So diclofenac gel is my next section of the evidence portion. And I talk about several things in this paragraph. I talk about the absorption of this agent being very low. And I'm saying that, therefore, since the absorption, the systemic absorption of this medication is pretty low, we shouldn't likely have as increased or as much of a risk of bleeding. But all the same, we don't have great evidence to support that we do have a lower risk of bleeding. I think that's important to state. So there's a systematic review regarding NSAIDs, both topical and oral NSAIDs, and their overall incidence of bleeding. And I go on to say, I define some of the population in the study, which I think is really important. Sometimes the population is really important to look at. So let's say we're looking at this systematic review, and the systematic review didn't really look at patients that were taking anticoagulants, or it didn't look at patients that were very old. We would say, okay, well, the systematic review didn't really look at patients that were already at increased risk of bleeding. So in one of the groups, in the oral NSAID group, they could have been all really, really old and at an increased risk of bleeding. Or they could have also been um, um, on an anticoagulant, and because they're on an anticoagulant, there could have been an increased risk of, at an extra increased risk of bleeding. And so because of all that, when I'm evaluating the literature, it's important for me to go through and see if they've kind of delineated that in the literature at all. And in this case, I've kind of expounded on that very briefly in that section. So if we're thinking about doing like a PIES analysis, that would be an important thing to bring up if I was looking at that study. All right. All right. So I go on to say the actual increase, the chances of bleeding on oral agents and systemic agents. So this is just the incidence of bleeding with systemic agents, 0 to 1%, and the risk of bleeding with oral agents, which is 0 to 2%. So one might say that there seems to be an increased risk of bleeding with oral agents compared to systemic agents. However, what you'd want to do is you want to keep in mind that this was a systematic review. And this is a range of incidents of bleeding in that systematic review. So we may have had 10 studies that were on systemic agents that had 0 incidents of bleeding. And one study out of those 10 or 11 studies said that there was a 1% incidence of bleeding. So on the average, we had a very low incidence of bleeding because of that. Whereas in our oral study, we could have had one study that had a 0% incidence of bleeding, and 9 studies that had a 2% incidence of bleeding, or vice versa. So we can't really truly say unless we look at that systematic review, we actually look at each individual study and their actual incidence of bleeding. So you want to make sure that you're interpreting systematic reviews appropriately, and you're not being potentially misled by things like ranges of adverse effects. So be cautious of that. Then I go on to say, despite the low incidence of GI bleeds with diclofenac gel, which is 0 to 1%, case reports exist suggesting it has, in fact, led to bleeding when combined with warfarin. So a case report is a very low tier in regard to evidence. It's one patient had this experience, right? It doesn't necessarily mean that diclofenac gel was what contributed to that person bleeding per se, or that really put them at that much more of an increased risk of bleeding. People that take warfarin, an anticoagulant, experience bleeds fairly regularly. It may have put that one person at an increased risk since they were on diclofenac gel, but it doesn't necessarily mean that diclofenac gel was something that put them at much higher risk. It's just one random case report, and that's or several incidents of that happening. When we could publish millions of or hundreds of case reports, thousands of case reports on warfarin itself, just posing an increased risk of bleeding, GI bleed, so on and so forth. So it's minimal evidence unless we really have a comparator, if we really have designed a specific study to actually test whether or not there is an increased risk of bleeding or if there isn't. So it's still appropriate to say that there have been some incidents where it seems like there may be an increased risk. But we don't want to assume that it puts them at that much more of a risk. Just in case. All right. So after all that, after we presented all the primary literature that we could find, all the information that we could find, ultimately, we don't have that much information. We have a systematic review that gives us some insight. We have a case report that gives us some insight again. And we can't really and truly say that there's evidence to suggest that diclofenac gel puts patients at that much more of an increased risk of bleeding when combined with an anticoagulant. So, the literature suggests that using NSAIDs in general with rivaroxaban is not a contraindication. And that's really important. Package inserts all say that. All of our authoritative references say that. But this combination does increase the risk of bleeding. Again, the package inserts also say that. All of our important authoritative references indicate that as well. Due to the limited systemic absorption of diclofenac gel, the risk of bleeding should be lower, but no data exists to suggest exactly how much safer it may be. All that's extremely factual information based off of the information that we have above. Before continuing diclofenac therapy, consider the patient's needs for pain management, so their need for taking an NSAID in general, the patient's age, which is going to put them at an increased risk of bleeding. If this is a patient we're looking at using diclofenac gel and they're 99, they have an increased risk for falls and so on and so forth. You need to consider that as well. Also, the concomitant medications that may increase the risk of bleeding. So if they're taking aspirin or other agents as well, and the patients are risk of falls. Proceeding with this combination, we need to monitor the patient's signs and symptoms of bleeding and encourage patients to seek medical attention if they notice blood in their stools or have a significant fall. So what should they look out for if there is a potential issue? We've addressed all of that, and we just thank them. Then we have taken one of our studies, and that's what I suggest you do. Even if you use 2 or 3 studies, just find one study that you can review and show me that you've looked at the population, the intervention, and the endpoints, and you found relevant things in that. So I've looked at the fact that these are patients with DVT and PE. I've said that these are patients who would be appropriate to be on rivaroxaban. I talked about their mean creatinine clearance. This is important for this drug. You can say there's a wide variety of renal function in general. For the most part, their renal function seems to be pretty good. So if they were having trouble excreting certain agents, NSAIDs may actually decrease their renal function. There could be an increased risk of bleeding there in itself and other hazards. So we looked at that. We also looked at their mean age, and we saw that both middle-aged and elderly were included overall. So that's an appropriate general way to assess the study. We looked at the intervention. So in group 1, we had rivaroxaban and NSAIDs, and in group 2, we had rivaroxaban and no NSAIDs. That is appropriate. Ultimately, we'd love to have a third group, maybe that has rivaroxaban and diclofenac gel, but that is not going to happen. So no diclofenac gel. Also, we've noted this is an observational study, and it's not as good as a randomized controlled trial. So we've assessed that intervention in some ways. We've assessed the study. And then we've looked at our endpoints. So clinically relevant bleeding and major bleeds were what they looked at, and those are great. So not only did we look at just major bleeds, we looked at just kind of relevant bleeding in itself, and that's appropriate. So this is a fine study. Didn't let us target in on diclofenac gel, but it was appropriate to look at in and of itself. So that's my interpretation. Again, I give myself a 97 because I made the citation mistake, and you can punch me whenever you want to. I cannot guarantee that you will not be expelled from the school for punching me, but you're welcome to punch me. I may try to block it, or I may take my cat and put her in front of my face, and then you'll punch the cat, and you'll feel really bad about yourself. She's a really great cat. She's been sitting on my shoulders. She does this. She does this. Hey, yeah, there you go. Oh, no, she doesn't. Never mind. She doesn't do that. I guess I lied. Nope, she's out of here. All right, she's out of here. Cool. Well, thanks for making me out to be a double liar, cat. All right. Well, whatever questions you have, you can email me. You can ask me in my office. Try to look out for office hours on Wednesdays and Fridays. Typically Fridays, 12 to 2 are pretty good hours for me. And Wednesdays, during your PPS block group stuff, I will be in my office. Wednesdays are good for me as well. Try to email me before you come in so I can make sure and set aside time. Sometimes I get kind of busy. But there's nothing else that I have to say. So I'm going to end awkwardly as I can. Is anybody even watching at this point? I haven't said anything worthwhile in like the past minute. or two. Here you go. Here's my cat. Here we go. We're gonna hold her like a baby. She loves. She loves. She loves this. Loves. She's a great cat. She's a good cat. Oh, listen to her. Yeah, you like that, don't you, kitty? Nope. She wants down. Why are you still watching this? Get a life, weirdo.